this episode of The Dog Show, we welcome back Dr. John Morgan. John is a partner veterinarian at Gordon Vet Hospital, where he specialises in orthopaedic conditions and arthritis in dogs. In the interview, we discuss parasites in dogs, including dog parasite symptoms, the most common parasites, and how to treat your dog for parasites. John, welcome back to The Dog Show again. Thanks for coming on.
Thanks so much for having me, Will. It's a pleasure to be here.
As always. So I want to talk to you today about parasites. It sounds like a horrible word, but what are parasites and how do they relate to dogs?
Yeah. So I guess, the term parasite really applies to any species that is benefiting from a host species, but in detriment to the host species. So I guess you're looking at anything that sort of latches on and definitely and takes nutrients or benefits from the host, and that can be a range of effects. So fleas are probably the most common parasite that will be ubiquitous across the world in dogs, and they, in small numbers, they're not going to cause too many issues. In large numbers, they can lead to anemia or potentially spread disease. So that's, I guess, you look at other diseases like heartworm, and that one actually is a worm that resides in the heart, as the name suggests, and that can actually lead to heart disease or congestion within the heart and potentially death. So we're looking at, when we're talking about parasites, we do try and obviously eliminate parasites as much as we can. It's also worth noting that parasites aren't always going to cause major disease or major issues in small numbers.
Okay. So you touched on a couple of them then, heartworm and fleas. Ticks, what are the other common parasites that we're talking about?
Yeah, so there's a host of intestinal worms. Obviously, that's another big one, which is probably as a result of dogs' behaviours. They're very close, very social animals, so worms do really get a free ride on that. And obviously humans can get worms as well, but dogs have quite a range of different species of intestinal worms, and they range from tapeworms, which are quite long in a lot of cases, or even and really small worms like whipworms and roundworms, more whipworms. They're quite short and can cause anemia as a result of consumption of blood.
Okay, and the parasites that dog owners should be looking out for different in Australia than they are elsewhere, or
so a lot of the parasites we see here are very, very common around the world. So a lot of intestinal worms are pretty much worldwide, but there's definitely a lot of variation depending on where you are in the world. It's not really any, I guess, Australian specific diseases I can think of, but we do see a range of different worms here that won't necessarily be overseas. There's also a more rural disease called echinococcus, which has a really major health implication for humans. So echinococcus is actually a parasite that forms cysts in the tissues of animals like sheep and kangaroo after they accidentally eat the parasite from dog feces in the environment. They take that in, it forms cysts in the tissues, and dogs actually, when they eat that meat, they become infested or infected with that parasite. And if we happen to accidentally ingest the worm eggs from dogs, so often kids playing in sand pits or being in quite close contact with dogs, if they happen to pick that up, it forms large cysts within us and it can actually be fatal. So one example of a rural Australian disease that's quite important to know about.
Is that pretty rare though, I imagine, or?
It's not uncommon. So dogs in rural settings, it's really important to keep them up to date with regular deworming, especially if they've got access to raw meat, or if they're being fed raw meat, in that sort of, in that they're getting kangaroo meat or potentially just leftover lamb meat. That will definitely predispose them to.
Is that because they could be eating wild meat as well, like raw meat when they find somewhere? Kind of thing?
Often it's sort of carry on, or it's a kangaroo that's died in the field or been shot and not picked up, so they'll have a go at it and unfortunately pick up that parasite.
Right. Okay, so how do we? You briefly touched on treating these parasites or the prevention of the parasites.
Yeah.
What does that look like?
Yeah, so most of it these days is oral. Most products come in a tablet or a chew form. it depends on what we're treating. So intestinal worms are largely treated by a deworming tablet, which obviously you'll have to make sure it covers tapeworm as well as roundworms. And then fleas and ticks are usually covered by either another product or an all-in-one product. So there are a couple of products that are trying to cover everything.
Yep.
They're not quite there. There's a few gaps in most of them, if not all of them, sorry. But yeah, we're generally giving an oral form to make sure that we're keeping ticks at bay in the east coast of Australia, especially, where they can cause death as a result of what's called tick paralysis, but also importantly fleas, which definitely can not only cause irritation, but again, if they're in high numbers, they can cause anemia and annoy us by biting us.
So when you said there's gaps in the medicine, is that saying that just because I've had the tablet doesn't necessarily mean I wouldn't get a tick and a tick paralysis kind of thing?
Well, yes.
Well, not me.
Not
my
you.
dog.
Yeah, you shouldn't be taking the tablets as well.
No, but I could still get a tick.
You could theoretically.
My mum gets them all the time.
Yeah,
in the backyard.
And that's it.
Yeah.
And in settings where that's occurring, we see the tick, we pull them off, or we've got somebody looking out for us, or you'll start to feel a bit unwell. And you'll yank it out. Dogs don't have that luxury. They can paw at an area, but they often don't feel it, or they can't dislodge the tick. And that if that stays there for 3 to 4 days, they'll start to develop signs of tick paralysis. So on that, I guess we do rely very heavily on these products. They seem to work really well, but nothing is foolproof. So we always recommend regular checks in this area to remove ticks. But yeah, most of the oral drugs actually do provide constant protection from fleas and ticks now, which is good.
What's actually happening, I've often wondered, with the flea and tick medicine, like is it scaring them away, or do they still bite, but it just prevents the paralysis side of things?
Yeah, a really great question. Well, yeah, it's so they will bite. They will need a small amount of blood, which has the drug in it, or the preventative in it. And then once they've taken that, they'll actually die. So it does kill them as a result of feeding, and they'll drop off and sort of fall off into the environment without reproducing.
Interesting. Yeah, I mean, it's an important thing to know about, because I know I've had a friend who dog got tick paralysis. They ended up being okay, but like it was kind of like they went to bed that night, and halfway through the night woke up and like was limp at the back legs and drained from energy and like vomiting and all this like horrible stuff.
Yeah, it's a really
and it can come on really quickly by the sounds of it. Yeah.
Yeah. So because the toxin takes a long time to accumulate from the first bite. So unfortunately the ticks are often there for quite some time. But once they hit that 4-day mark, the symptoms come on really quickly. Right. And unfortunately in a lot of cases it is fatal. So dogs, stop being able to breathe, or they get a really bad lung infection. And it's really, really quite detrimental and really important to get to a vet. Obviously, this isn't something that goes away. No. Once you remove the tick, they do need to get an anti-serum and they need to be treated immediately.
Yeah. I guess that's why it's so important to know. I mean, obviously, if you've got a vet that you trust nearby, great. But if it's overnight or something, you need to know where your emergency vets are as well.
Always worth having that card. We always give out the emergency hospital's card to make sure you've got it on the fridge, because the last thing you want to do is to sort of have that panic or not be sort of ready to go. So it's always worth sort of doing your research before something happens, because emergencies happen all the time.
Yeah, I remember one time, and Frankie has the monthly NexGuard, which is the brand here in Australia, which covers a few of those parasites, I believe. But I remember one time she was sitting on my lap, and like I was just like patting her or something, and I noticed like a black tick.
Oh, you found one?
Flicked it off her. Nice one.
Yeah, before it had attached. Yeah, good
one. Which was, I didn't really know what a tick looked like, but obviously, I mean, after seeing that, I kind of knew afterwards.
Yeah, so they kind of look like it would have been like a modified spider.
Yeah,
like the way they
little
move.
Black thing.
Yeah. So they come in. So here, or the species that we often see here, have different life cycles as well. So they can range in size from the size of the tip of a pen. And they can actually go up to sort of quite large, so almost a centimetre in diameter when fully engorged. So depends on the life cycle as to the size of the tick. Whereas fleas, a little more commonly, are quite small, and you don't often see them. But what you do see is if you part the hair, there'll be lots of little black dots from where they've been feeding and leaving basically a bit of poo behind, which is the dried blood of the dog.
Yeah, so what are the main differences between a flea and a tick then?
So fleas are insects. And then ticks are technically arachnids, so closer to spiders.
Okay.
And they're the ticks do need to sort of really latch on. So they form a cement to actually adhere their mouthpiece to the dog, and they don't move. Some ticks do move a little bit, but they're sort of stationary while they take a decent size feed. But the tick that we get here, it actually latches onto one spot and it doesn't move until it drops off and then goes through its next life cycle. Fleas, they've got the run of the house. So they go from spot to spot getting small meals of blood, and they tend to focus around the tail base, or sort of at the bottom of the tail on the back, all the way up, sort of midway on the back, and can be seen anywhere on the dog, sort of crawling away. As soon as you part the hair, they'll often scamper away like mice in light.
Okay. Yeah. So let's talk about treating them a little bit more. So say, for example, you've got the monthly, tick and flea prevention tablet, which is what I do. But let's just use my example. So I use a monthly tick and flea tablet, and then I think it's a 3 monthly intestinal worm one. Would that be right?
That sounds about right. Yeah.
So let's say you're doing that. What else can I be doing to watch out for parasites and to keep my dogs safe?
Well, as always, the standard caveat for me is talk to your vet.
Yeah.
But yeah, you can actually be pretty savvy on preventing them in an external setting as well.
Okay.
So fleas flourish in domestic environments, surprisingly enough. A lot of people say, oh, my dog hasn't been anywhere, or how did this flea burden happen? They actually do really, really well in houses because they're well protected from the elements. We usually have nice climate control, keeping things at a nice stable temperature for them to reproduce. And so by doing things like regularly vacuuming the areas that dogs commonly in, and keeping that area sort of free of dander, they don't have the food that they need to then go on to the next life stage, which is on the pet. So they'll, as an egg and a larvae, they'll actually live in the carpet or the floorboards,
right?
And then they'll sort of come up from there afterwards to feed the dog. So removing dander and keeping the area clean is really helpful for preventing that. Ticks, obviously they don't get indoors; they love the outdoors. And prevention for that one is your, most importantly, your oral stuff, or getting a product that actually prevents them once they do attach. But obviously, just being wary of certain areas. And if you do see a tick on your pet, just think back a couple of days and think, where would I have picked that up? So have you been on a bushwalk, or have you got wildlife in the backyard that might be bringing that into the backyard? It's worth sort of looking at those settings so that you can be a little more proactive on stopping that attachment. Especially noting that while we don't have tick diseases in the paralysis tick, there are a lot of dog-specific tick-borne diseases, or basically diseases that are spread by ticks. So it's really, really important to make sure that if you're in those areas, just to make sure that you're thinking about the ticks that are attaching.
Interesting. The cleaning one, I'm sure if I tell my wife, that'll make me need to clean a lot more.
Yeah, keep you busy.
Keep me busy. So what do I do? Like, what am I looking out for if maybe my dog has already been infected by a parasite? What do I need to do then?
Yeah, well, and sometimes you'll have no idea. And in fairness, if dogs have a worm burden, a lot of the times it'll be as a puppy, especially, they'll just have a pot belly and they won't seem to grow as well as they should. It's only until it's only until after you worm them that you see all the worms actually come out, because they're not being shed. You won't actually see them. They'll be residing internally. So we need to use tools like fecal floats or just regular treatment to try and eradicate.
Fecal floats? What are they?
Yeah.
Sorry.
Yeah. So a fecal float is basically a way of testing for eggs. So we'll often take a little bit of feces and put a salted water, or water with a high salt content, and that'll actually cause all of the eggs to float to the top of that solution. And then we can actually use that to look for the eggs or larvae of certain parasites.
Right. So that's what you're doing to find it. But
what can you do at home?
Yeah, well, I guess what am I looking out for?
Yeah, I guess that'd be the main one, would be a lack of weight
bloating
gain,
and that kind of stuff.
bloating. Yeah, even muscle tone starts to diminish quite significantly, and they'll seem to eat a lot of food but never really gain weight that well.
Right, because the worm's taking all the food.
That's it. That's the job.
Yeah, and I guess with the flea and tick, what are the difference in the symptoms there?
Yeah, well, so again, a real range. So a lot of dogs. So the everyone thinks that a dog with fleas will be itchy.
Yeah.
So I imagine that's sort of
the first sign you're looking for.
Yeah. Not always 100% consistent with fleas. So dogs actually have to have an allergy to flea bites to then be itchy. So there's a lot of dogs that will have quite a high flea burden and they'll just be happy as Larry. They don't know that anything's going on. It's only after your treatment and the fleas are wriggling oddly or acting a bit differently that they get very agitated temporarily. But they may be completely asymptomatic except for a lot of the times blood loss. So they can be quite anemic as a result of fleas. But yeah, certainly fleas, you look for itching. Ticks, again, depending on the area, that you may not have any signs, which is why it's worth always doing a pretty thorough check if you're in a tick-affected area.
Yeah. And what's the easiest way to do that check? Is kind of like run your hands along the dog's fur?
Hands tend to be not as sensitive.
Okay.
So we actually tend to push for fingertips.
Yeah.
And you can sort of incorporate it in as a bit of a pat.
Yeah,
so,
yeah.
Obviously, dogs come in all shapes and sizes, different fur coats. But we generally recommend running your fingers along the dog in sort of a against the fur fashion. So you're running your fingers all the way. I'm sure I have an example here.
Sorry, you can't do it on me.
Yeah, so you want to run your hands with your fingers first all the way along the dog, especially around the face. So Ixodes polycyclus is our local paralysis tick, and that one generally lives around the face and neck. So I think it's something like over 90% are found in that area. So focusing your efforts around the face and neck, because they think that it's carbon dioxide coming out of the nose and mouth that stimulates them. And then obviously do the rest of the body all the way up to the tail tip and in between the feet. Not only does that help you find a potential tick, which feels like a little bump or a lump, almost like a mole, but it'll also give you the opportunity just to look for other masses or tumors potentially, and obviously help with that bonding experience, so that the dog gets a lot more comfortable with that as well.
So how often would you recommend doing that?
I guess it depends on the area. Before the days of prevention, we were saying daily in tick-affected areas. We were seeing probably upwards of 150 cases per season of dogs that needed to be hospitalized for tick treatment. And that's obviously was our main defense at the time. But the prevention's made it a little bit easier, but I'd probably still say at least every second day.
Okay. Even
if that's incorporated into a good old pat.
Yeah.
And even if it's just focused around the head and neck, I think if you're in a tick-affected area, it's worthwhile.
Okay. So if we went back and kind of summarized everything to do with parasites and parasite prevention for dog owners, what I'm hearing you say is obviously you need to get some prevention medication that you can have on a regular cadence, based on whatever you choose, what product you choose and what your vet recommends. On top of that, you can do these things that you're discussing just to watch out for symptoms, but also checking your dog for parasites.
Yeah, I think so. Watching for symptoms is a big one. And if you're noticing anything different about eating habits, talk to your vet. And we do definitely, it's worth noting that we do have some resistance creeping in with treatments as well. So we've already seen evidence of fleas not responding to certain older generation flea treatments, and intestinal wormers not being effective for the whole spectrum of intestinal worms. So if sometimes vets will just throw dewormers at the situation, but sometimes it's worth, maybe pushing a little bit more for fecal testing or look into it if you feel that something's going on there.
It's good to know that, because I feel like, I personally have, I think I've switched off and said, I'm giving the tablets.
Yeah.
We're good here.
Yeah,
we're good here.
It's a dome of protection.
Yeah.
Yeah, it's not quite the case. So there's definitely a couple of examples of intestinal parasites that have shown increased resistance over time. And unfortunately, that's going to be the case as we go forward with these products. And fleas especially. We had a run where dogs just weren't responding to the treatments that we had available. So luckily, we've had this new generation, but it's worth keeping in mind that probably not ticks, but certainly fleas may get to the point where they're not responding as well because of resistance.
Yeah. And as you said, that's probably, the drug companies, I imagine, are going to be improving that and following those trends as well.
Exactly.
So it's good to be kind of keeping up the cadence of buying the products as well.
Yeah, and keeping it up to date, and also looking, not just relying on it blindly, as you mentioned. So the cleaning and preventative strategies that we talked about are also really important.
Clean your house.
That's
the big takeaway.
Keep the dog areas tidy and wash the dog's bed. It's a big one.
Okay.
Yeah, because they'll live pretty comfortably in there for years.
Yeah, okay. So how often should you be washing a dog's bed?
Well, yeah, it's a tricky one. I probably...
Or my bed if it sleeps on.
You should do your sheets weekly. That's my personal approach. But I mean, monthly is probably acceptable.
Okay.
If they're a particularly clean dog, obviously if the bed gets dirty, then chuck it in the wash. But
Yeah.
I think monthly would be fine, even every 2 months for a particularly clean dog. But a hot cycle is often recommended to just really eliminate those fleas. So if you're looking at dog beds to buy, just make sure it does have that little tick washable.
Okay. Yeah, it's interesting because I guess you don't see those things on the bed, right? Until it's too late.
Exactly. And you can't see them, they're microscopic. So
Yeah.
unless you got your magnifying glass out, you're going to miss it. On the prevention side of things there, Will, as well, I think there's been a bit of a trend to sort of targeting some of the preventions as being more dangerous than treating.
Oh, right.
Yeah.
The tablets.
Yeah. And there's a few sort of online movements or Facebook pages against the product you mentioned, NexGard and Brevecto.
Oh.
Where our experience is far from that. I mean, we've never really seen a reaction, and we're using them pretty liberally.
What type of reactions are they talking about?
Range depending on the group.
Right.
On Facebook, so some of them, talked about seizures. Some of them talked about other, fatalities associated with it. The drug companies that produce them have stood by it, and they haven't found any evidence that there has been any sort of reactions that have been noted by these pages. But our experience, just to weigh in, is that they're generally providing a better service than causing illness. I can't think of a case in recent.
Well, my personal experience, I've had dogs for over 15 years in my life, and we've always used those products, and we've never had a tick or a flea, and we've also never had, those bad side effects you're speaking about. So that's just one example, but I trust them.
And I think the generational change, like the NexGard, Brevecto, and all the other oral flea and tick products, at least here, have probably saved thousands, if not tens of thousands of dogs' lives. So tick paralysis is definitely a big killer here, unfortunately. And we've been grateful to see a real reduction in those case numbers from our perspective, which is great because it's a horrible disease. And we don't want to see it anymore.
Well, I guess as well, I mean, it's like with any medication, there's probably going to be outliers where there are bad side effects. It doesn't react well. Like everyone's slightly different. It's the same with humans. There's going to be examples where something, you've got an allergy to it or something,
Yeah, and I'm not going to say that they're 100% guaranteed safe because that's obviously not the case. We are always taking a risk with any medication. Unfortunately, there is a bit of a balancing act between medication, their side effects, and medication in terms of their benefits. But for us, it's a no-brainer. Like stick to the best product available for tick prevention, and it in a lot of cases will save your dog's life.
I agree. Well, John, thanks so much for sharing all that advice about parasites. It's been really interesting. I've learned quite a lot, and I'm sure everyone else has as well.
Well, hopefully, one thing per podcast is what they need from me.
Yeah, no, it keeps it simple for me as well.
Thanks very much for having me, Will.
Thanks, John.